Welcome back to Persistence Pays. As I said, today we're talking about color, and this segment now we're going to talk about a different kind of color. We're going to talk about thermography, and thermography is a screening, and I'm going to let Dr. Mostovoy describe exactly what that is, and we have Laurie-Ann Whitnall in the studio as well. But thermography is a screening for
risk breast assessment.
For risk breast assessment. So if we look at, so just tell me a little bit about where thermography came from and how you've kind of come to do this kind of research.
I actually came into thermography as a critic, as a skeptic. So that started 13 years ago. 13 years ago was the start of my journey, if you wish. And since then, now we have 35 clinics around the world, most in Canada, in the United States, in South America. Thermography, as the word kind of implies, deals with temperature, just like colors. Yeah. It also deals with assessment. And thermography actually should be changed to thermology. So it's the science of heat, and heat naturally radiates from our skin. We are able to look at it and see what's going on behind the skin by assessing what actually comes out to the surface of the skin. So we naturally emit radiation, infrared radiation, that with the help of infrared camera we can screen and see what's going on. Okay, so just like imagine you're having thermometer, right? Also sounds the same as thermography. Only one thermometer. Our infrared equipment allows us to have 78,000 little thermometers probing your whole body.
So when you go, and I did go to Laurie-Ann and have a thermography test myself because I wanted to understand what it was before we came on the air to talk about it. And really, you know, you make sure you don't have any heat under your armpits or where your body normally generates heat. Right. And then it's like it doesn't take very long and no pain. It's not like going for a mammogram. I always say, you know, mammogram is like going to put your breast in the car door and slamming the door shut. That's kind of what it feels like. So there was no pain with this at all, and it's really just a risk assessment tool. Is that how you would describe it?
There's no compression. There's no radiation. There's no contact. The reason, actually, the longest that you sit in thermography kind of room is when you are acclimating to that temperature. Right. So the protocol is that you come in, you undress, and you sit there for 15 minutes just to acclimate to that room temperature where it's kind of normal. Then we take a set of images, then we perform cold challenge, and then again we do another assessment after the cold challenge to see how you regulate, if you wish. And from there, all of that is sent to our reporting services where we look at that, analyze, and the system of analysis allows us to deal with risk assessment. So generally we look at TH1 low risk, TH5 high risk. Now let me say that, which I say actually to every single woman that I see. Just because someone is low risk, it doesn't mean that there is no risk. Just the same, just because someone is high risk, it doesn't mean that we're dealing necessarily with malignancy. But if we can look at thermography, because thermography really is a test of physiology. Okay, you mentioned mammography, which is also very useful. Mammography is a test of anatomy. Okay. Now, physiology will always precede anatomical or structural change. Let me give you an example. Before any kind of lump develops anywhere, particularly, let's say, in the breast, before a lump develops, it has to have blood supply. Especially if it's a malignant lesion, we're looking at something that's metabolically much more active. Now, because it's more active, it gives our brain a chemical message saying, we need more nutrients. And more nutrients are brought in by additional blood supply. That blood supply is going to register as additional heat, and this is exactly something that we can track. And if we can track that early enough,
Mm-hmm.
then we can forewarn that person that maybe something is going on and they can start making changes.
Right. Now you brought some photos, some pictures in for us to take a look at, and maybe you can tell us what those pictures mean and how we can
Gladly.
understand
So when
them
we're
a little
looking
bit better.
at something like this, on the right-hand side, you're looking at a color scale. So just before, we're looking at darker colors that are cooler temperatures, and lighter colors are warmer temperatures. So for instance, you'll see, let's say, the right breast, which is on your left, mostly color green, you're looking at about 28, 29 degrees Celsius. When you're looking at yellow, it's maybe about 30, 31. Once we get into 34 degrees, everything becomes red. Now, the left breast, which is on your right because it's in reverse, you can see a lot of red. You can see that breast, the nipple temperature is much, much higher. So we're not looking really at colors because colors simply represent temperatures. This particular patient came to us many, many years ago, and she was routinely screened like she's supposed to with mammography for many, many years. And when we looked at something like this, my next kind of feeling is that this is definitely high risk. The next one we're looking at, again, something asymmetrical. When we see something asymmetrical on one breast, see, we have two breasts. So symmetry maybe is boring in artistic circles, but when it comes to your health, symmetry is the best thing that you have going for you, because naturally nasty things do not grow in symmetrical patterns. And this is finally before and after shot. Again, before you see a lot of vascular activity on your left side, and finally on the right side, you see 6 months later with simple things like adding indole 3-carbinol that's made from cruciferous vegetables, this particular patient is able to regulate her estrogen metabolism. And speaking about that, I think Laurie-Ann has an interesting story that just came up today. Yeah, do you want to share with us?
Sure. A friend of mine was screened over a year ago and came back with a medium risk area to watch, and followed up, and it again was elevated, and she took it to her doctor and they raised up the next level. Long story short, it ended up they did a biopsy in 2 locations that showed up on her thermography screening, and the one has turned out to be early stages of cancer, and it's small enough that it's a lumpectomy, and it wasn't picked up yet on the structural test. So good news, bad news. Good news that they caught it early to do something. So
it was through that screening that they came across that.
Yeah, and it's something that we had been watching the last year, and it hadn't been showing up on her other screenings. So, it's an early detection, right?
Yeah. Now, thermography is not covered by OHIP. It's not covered, through normal health plans. So
that's correct.
Women and men can have this as well, correct?
Well, generally when we deal with breast thermography, we generally deal with women.
Okay.
However, thermography could be used for all over the body. We're looking at dental screening. We're looking at thyroid. We can look at basically any structural change when we're looking at things like neuromuscular, neurovascular, anything to do with heat and or inflammation. And that's going to show up very well with thermography.
Okay, and so it's what is the cost to have a test done?
Breast thermography is $250.
Okay.
And that includes all the imaging and reporting, and even a small, short follow-up explaining the findings.
Right. And where does the scientific evidence come, like the research? Where does that
Actually, thermography started, of all places, in McGill Medical School in Montreal. So the first breast thermography study was done in 1956 by a Canadian physician by the name of Ray Lawson. So he thought about that obviously breast cancer is going to probably come up with something hot on the breast. And then he started experimenting with this technology. So that was the first ever study done around the world. Since then, we have had over 800 peer-reviewed studies published in the past 30, 40 years. There's a lot of science behind this. I mean, if you think about it, it's not that sophisticated because we're very much used to measuring temperature when we have fever. And I can tell you another story, that every single horse track in North America has thermography cameras. So they assess horses before and after racing. Why? Because they're very expensive animals. So they don't want to injure them, obviously, before or after. They can see if they have been injured, for instance, after the race. So the same thing applies, I think, to human anatomy and physiology, that we can look at things before, in some cases, definitely, before they even become painful.
Right.
And that's how thermography is used.
So tell me, there's been some misconceptions about thermography on the news. So tell me about some of those misconceptions.
Well, some people kind of decided to say that thermography can replace mammography. This is absolutely not true. These are completely different tests. One, as I said, is a test of physiology and function, and the other one is a test of structure and change. But as I said before, there is going to be a change, there is going to be a functional or physiological change, and we can track that change. There's another misconception, is that a lot of people think that it replaces mammography, and of course it doesn't. So we actually need two tests to get much better results in terms of early diagnosis. But it's not just about early diagnosis. I'm a big proponent of preventive medicine.
Right.
Because if we can warn someone like yourself and say, look, you maybe is at higher risk than you want to be, let's take a look and see what drives that risk. Maybe it's your hormones, maybe it's your diet, maybe it's your lifestyle, maybe it's emotional.
Yeah.
There may be different variables here. Let's sit down and work and try and lower your risk, and then come back in a year and see how your breast responds to all this.
And when you look at those pictures of the before and the after, you can see the difference of some changes that that woman has made to have her go from all red to having more color.
That's right.
Yeah. Well, it's great, and I mean, I think we all are responsible for our own health, and doing anything that we can to remain healthy is a good thing. So I really want to thank you for coming on the show and sharing your light and your knowledge about thermography and how that can help women not to to help with their risk and help them to really take care of themselves and take care of their health. How can we find out more about thermography?
You can go to thermographyclinic.com. If anyone is interested in articles, they are there. We have 10 pages of studies. So just to back up that this is very scientific. We have videos, so if someone wants or is interested in this, definitely all the information is there. And thank you for having us. Okay, well, thank you, Doctor, and thank you, Laurie-Ann. I really appreciate your time for coming and sharing this information with us. So thanks for joining in, and we'll see you next time on Persistence Pays.